Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're doing another Kahoot, and we're going to be going over blood transfusions. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're gonna love it. Go ahead and give it a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already. And be sure to check out my website, nexusnursinginstitute.com. There you can sign up for a next generation NCLEX review session, part 1, part 2. You can sign up for a private tutoring session with me. You can sign up for a consultation session. Maybe you just want to pick my brain about something. You can get some audio lessons very soon. My Nexus Nursing Test Bank is coming out. I've got lots of resources already available on my website and lots coming your way down the pipeline. Again, the website is nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my social media platforms such as TikTok, Instagram, Facebook, YouTube. My handle is the same everywhere, Nexus Nursing. Now, without any further ado, guys, let's get started. Blood transfusions. First question. Your patient asks you why her platelet infusion is running so quickly. How should you respond? Here are your options. It's running quickly to prevent clotting in the tubing. Platelets have a short half-life. The faster infusion ensures better absorption, or rapid infusion decreases the risk of transfusion reaction. So your patient is asking you why her platelet infusion is running so quickly. How are you going to respond? What is the correct answer? This is interesting. Well, most of you guys got it right. It's running quickly to prevent clotting in the tubing. Think about it. What do platelets do? Clot, right? Do we want the clotting in the tubing or in the patient? One in the patient. So we're infusing it quickly because we know that platelets clot and we don't want it clotting in the tubing. All it's going to do is cause obstruction and it's not going into the patient. So that's why it's running quickly. Now, 49 of you guys chose platelets have a half-life. Now, let me tell you something. You got to be very careful because what I just did to you, NCLEX will do to you. And you can't fall for it. Just because an answer is true doesn't make it true for your question. Yes, platelets do have a short half-life, but that is not why it's running quickly. Right? So even though it's true that platelets do have a short half-life, we have to answer the question. And the question is, why is infusion rapid? And the fusion is not rapid because of the short half-life. The infusion is rapid because we don't want clotting in the tubing. The next option, the faster infusion ensures better absorption. Are you kidding me, guys? Platelets that's so funny. Platelets are not absorbed in the same way as medication. So no, we're not infusing it quickly because it ensures better absorption. We're not talking about medications. The absorption is different than medication. So that's false. And then last, rapid infusion decreases the risk of a transfusion reaction. No, the speed of the transfusion does not dictate whether the patient will have a reaction or not. So the correct answer is because we don't want to have clotting in the tubing. That's why it's running so quickly, okay? All right, next question. What's your priority action if your patient develops urticaria and itching? Look at that photo. Are you going to stop the infusion? Are you going to slow the infusion? Are you going to administer diphenhydramine as ordered? Or are you going to document the reaction? What do you guys think? You guys are doing great on the live. Very good. Stop the infusion. Whenever something is harming your patient, the very first thing you're going to do is stop whatever's harming them. What is urticaria? That's when you break out in hives. Patients breaking out in hives, they're itching. What do you think is happening? What type of allergic reaction, guys on the live, tell me what type of allergic reaction you suspect is happening. Urticaria, itching. Very good. Anaphylaxis, allergic reaction. Okay, so the first thing you're going to do, you're going to stop that infusion. You're going to stop the infusion. You're going to give the patient normal saline. You're going to give them diphenhydramine. That's their Benadryl. That's for the allergic reaction. You're going to take the patient's vitals. Notice I listed off a million things before you call the healthcare provider. Why? Because when you're calling that healthcare provider, you have to have something to tell him or her. What did the patient look like? What happened? What did you do? What did they look like after you performed your nursing intervention, right? You have to have information to provide to get more orders. So very good. The first thing you're going to do is stop what's harming them. Great job, guys. You're verifying the blood product with another nurse before administration. Which information is most critical to verify? Would it be the patient's blood pressure? Would it be the blood product's expiration date? Would it be the blood type and compatibility? Or would it be the rate of infusion? Again, you're verifying the blood product with another nurse before administration. Which information is most critical to verify? Blood pressure, blood product expiration date, blood type compatibility, or rate of infusion. Very good. Blood type compatibility. Because if we don't have that, if we have a mismatch, nothing else on this list matters. It does not matter because the patient's not going to get the blood. We have to avoid a hemolytic reaction at all costs. This is deadly. This is lethal. You will mess around and lose your license at the minimum, right? Okay, let's keep going. Which patient is most likely to require a transfusion of fresh frozen plasma? Would it be the patient with anemia? Would it be the patient with thrombocytopenia? Would it be the patient with DIC? Or would it be the patient with dehydration? You're going to administer fresh frozen plasma. Which patient would you expect to give this to? Again, here are the diagnoses we're looking at: anemia, thrombocytopenia, DIC, dehydration. This is interesting. Most of you guys chose the wrong answer. All right, let's talk about this. So, fresh frozen plasma. When would we give fresh frozen plasma? We would give this to the patient that we need to replace clotting factors, right? And that would be that patient with DIC. DIC is a horrible, what's the word I'm looking for? Not rotation, but something that goes on and on and on, where the patient's bleeding, then they're clotting, then they're bleeding, then they're clotting, then they're bleeding, and they're clotting, depending on where cycle. That's the word I was looking on. Cycle, right? So this patient, they're going through that bleeding phase. They're not having enough of the clotting factors. So we expect to give that to a patient such as DIC. Now look at your other options. That patient that's anemic, what would you expect to give them? We're going to give them packed red blood cells, right? That patient with thrombocytopenia, I know it looks like a big word, just break it down. Thrombo, clot, cyto, cell, penia, a little bit of, right? So a little bit of your clotting cells, what? Platelets. Patient with thrombocytopenia, you would expect to give platelets. And last, dehydration. Well, if your patient's dehydrated, you're going to give them fluids. Duh, that was an easy one. How did 5 of you guys go with dehydration? I don't know. But anyway, when it comes to fresh frozen plasma, again, these are clotting factors that you're going to replace. You expect to give it to a patient that has a condition such as DIC. Now remember, albumin, that is the protein portion of blood. Okay. Your patient develops a temperature of 101, chills, headache. What type of reaction is this patient most likely experiencing? Would you say it's a hemolytic reaction, a febrile non-hemolytic reaction, an allergic reaction, or circulatory overload? What do you think? Again, temp, chills, headache. Fever, chills, headache. What do you think's happening here? This behavior is not in line with our policies and may result in suspension. You got to be kidding me. All right. So the correct answer is febrile non-hemolytic. Fever, chills, headache. Absolutely. Absolutely. Um, and the key to this, guys, was really that fever, and we're lacking the other symptoms that we see in the other types of transfusion reactions. And what do I mean by that? Let's look at hemolytic reaction. Again, guys, this is lethal. It's deadly. We got to be very careful. But when it comes to hemolytic reaction, we would see things like the patient complaining of really, really bad back pain. We would see very, very dark urine. Patient would have hypotension. Remember, your blood pressure is supposed to be 90/60, so the blood pressure would be a lot lower than that, right? That would let us know, okay, this patient's having a hemolytic reaction. An allergic reaction, we talked about that. The patient would have urticaria where they break out in hives. They, be itching. And then circulatory overload where the patient's got too much fluid going into them. The patient have shortness of breath. They'd have dyspnea. They have distended jugular veins. You guys absolutely need to know the difference in the different type of blood transfusion reactions. You got to know the difference. TikTok does this to me all the time. It says that my material isn't original because I'm using Kahoot. All of these questions I made up on my own, like literally. The correct answer is febrile non-hemolytic reaction. Because if it was hemolytic, the patient would have had things like back pain, they would have had dark urine, they would have had hypotension, and they wouldn't have had a fever. So the answer to this is febrile non-hemolytic reaction. Winnie Brown said they're hating because they don't want us to learn. Okay. All right. You're administering platelets to a patient. What is the most important step to take prior to starting the infusion? Would it be to warm the platelets to room temperature? Would it be to prime the tubing with D5W? Would it be to administer the platelets within 4 hours? Or would it be to obtain vital signs? Again, you're administering platelets to a patient. What is the most important step to take prior to starting the infusion? Here are your options. Warming the platelets to room temperature, priming the tubing with D5W, administering platelets within 4 hours, or obtaining vital signs. Very good. The first thing you're going to do is get a baseline. NCLEX is huge on seeing if you can recognize trend, specifically downward trend. And guess what? The only way you could recognize the downward trend was if you had baseline information to begin with. That's why they're so big on assessment and then following the patient to see if there are any changes, to see if you can note anything significant. The first thing you're going to do is get a baseline so you can have something to compare with. Now, look at our other options. I'm so happy most of you guys chose the correct answer, which was assessment. You're going to get a baseline vital so you can have something to compare and note significant changes. The first one, excuse me, warm the platelet to room temp. You crazy? You warm that platelet, you want to know what's going to happen? You're going to cause hemolysis. We don't do that. Next, prime the tubing with D5W. Of course not. The only solution that is compatible with blood and blood products is what? Normal saline. So no on the D5W. Next, administer platelets within 4 hours. That was a trick question. I tricked 7 of you guys. It's not platelets, it's RBCs. Packed RBCs needs to be transfused within 4 hours. And the reason it needs to be transfused within 4 hours is because anything past that, the risk of bacteria growing has increased. But we're not talking about red blood cells here. We're talking about what? Platelets. Remember, platelets cause clotting. Platelets have to be infused quickly. And when I say quickly, I mean within 30, 60 minutes, 60 minutes top. Okay? Read very closely. Platelets, 30 to 60 minutes. Packed RBCs, up to 4 hours. 4 hours is the max. Make sure you guys know the difference in that. And those were the options. The correct answer is vital signs. Something I didn't mention to you on the last slide when we were talking about the febrile non-hemolytic reaction, I didn't tell you why this was happening, and that's important for you guys to know as well. What's happening, the patient's having, the fever, they're having the headache, they're having the chills. It's happening because of the leukocyte antibodies. It's the patient's reaction to those leukocyte antibodies, okay? You need to know that. All right, moving on. Are you guys good on the live? Yes, for the packed RBCs, the maximum of time you can infuse is going to be 4 hours, because anything more than that, there's an increased risk of bacteria growing. We don't want bacteria growing in that blood, because that's blood we're giving to the patient. You want to cause that patient to have a septic infection? Absolutely not. That's why 4 hours is the max. Now you can give it, within 2 hours, 3 hours. All of that is within the normal time frame. You just can't surpass that 4 hours. Hemolytic is just breakdown of the blood cell. Hemo, the blood cell, lytic, breakdown. That's all it means. It's just a fancy word of breaking down of those blood cells. That's all it is. Okay, true or false? You must stay with the patient for the first 15 minutes of a blood transfusion, because most transfusion reactions occur during this time. Is this true or is this false? What do you guys think? True or false, guys? If you are not inside of the Kahoot, that's fine. Just type in your answer on the live. You can still participate. True. Yes. The first 15 minutes, right after that infusion has started, that is the most critical time that most likely the patient's going to have a reaction, if they have a reaction. True. True or false? It is acceptable to use lactated ringer solution to prime blood transfusion tubing. Is this true or is this false? Again, it is acceptable to use lactated ringer solution to prime blood transfusion tubing. Is this true or is this false? What do you guys think? Very good. It's false. It's false. I just told you 2 slides ago that the only solution that is compatible with blood is normal saline. So how are you going to use lactate ringers? Only normal saline when it comes to blood transfusions. I'm gonna take a step further. I'm gonna tell you why you can't use lactate ringers, why it's not compatible with blood or blood products. Lactate ringers has calcium in it. Okay, Professor D, what's the problem with calcium? Well, guess what? The calcium that's in lactate ringers, it interacts with the citrate that's in the stored blood. That's why. That's why, and it can cause clotting. So again, the only solution that is compatible with blood and blood products when it comes to transfusions is going to be normal saline. All right, guys, we've got 2 more slides. You're educating a patient about signs of delayed transfusion reaction. Which symptoms should the patient report? Is it back pain, hypotension, jaundice, or urticaria? Again, you're educating your patient about signs of a delayed transfusion reaction. Which symptoms are you going to teach that patient to report, or which symptom, I should say? Back pain, hypotension, jaundice, urticaria. What do you guys think? Oh, you guys are doing the most on the live. Mm-mm. Wow. Most of you guys went with back pain. I said to you guys earlier, a couple slides ago, back pain, dark urine, hypotension, low blood pressure, that goes with hemolytic reaction. This question is not asking about hemolytic reaction. This question is asking about delayed transfusion reaction, which is hemolytic reaction, but delayed. So it's not back pain. It's not hypotension, which is also a hemolytic reaction, but we're talking about delayed transfusion reaction. So it's not that. It's not urticaria because we talked about that already. That would have been allergic reaction, right? It's jaundice. It's jaundice. Jaundice is an indication of a delayed hemolytic reaction. Guys, you have to know the difference of the different reactions. Don't shoot the messenger. I'm just letting you know what NCLEX expects of you. What do you mean? What's the answer? It's right here. Jaundice on the screen. You see the check mark? Jaundice. Last question. You observe dyspnea, crackles, and jugular vein distension in your patient. What is the most likely cause? And everyone should get this because I actually gave you the answer when I was explaining something else. You observe dyspnea, crackles, and jugular vein distension in your patient. What is the most likely cause? Would it be allergic reaction, febrile non-hemolytic reaction, circulatory overload, or hemolytic reaction? Very good. Circulatory overload. Very good. Circulatory overload. I'll give you a bonus one. Let me tell you another one NCLEX has asked about over and over and over and over again when it comes to blood transfusion reactions. They'll give you a list of patients with different diagnoses and they'll ask you which one would you monitor most closely for circulatory overload. So there are 4 patients, they're expected to get blood transfusions. Which one would most likely go into circulatory overload? And they'll give you 4 different patients. And without fail, one of the patients that they'll give you, and that's the one that's the right answer, by the way, is a patient with congestive heart failure. And it makes sense, right? The patient's already in cardiac compromise. The heart can't push out all the fluid that it has already. And now the patient's getting more fluid into their body. So they're going to be at risk for circulatory overload. Don't say I never helped you. I just gave you an answer. Right? Yes, CHF. Absolutely. Haley just asked kidney disease too. Absolutely. But matter of fact, Haley, you just gave that's another question. So I'm happy you mentioned that because I forgot about that one. So there's another question just like the one that I explained to you, except the difference is just like that, but they'll give your patient like with CHF, and then they'll give your patient with kidney disease, but it's chronic kidney disease. And when you look like in the patient's chart, you'll see that the patient's being treated, and basically there's nothing acutely going on with them. So like you look at the GFR, the BUN, the creatinine, like everything's like, you know, fine. There's nothing acutely going on with them that they're holding on to fluids like the like that CHF patient is. Does that make sense? Thank you. You reminded me of that question because I forgot about that one. Yep. All right, guys. So let's see how you guys did. Those of you who are watching from YouTube, please in the comment section, let me know what you thought about this video. Let me know what you'd like to see me cover next. And let me know which format. Do you want it in a Kahoot format such as this live? Do you want it in a lecture format where I'm just teaching you about the information? Or would you like it in a Q&A format such as the videos that are released every Sunday at 1 p.m. Eastern Standard Time? Go ahead and sound off in the comments. I can't reply to everyone, but I do read your comments and I try my best to accommodate. All right, guys, let's see how you guys on the live did.